It's Debbie Turlington.
Yeah.
Is that right?
Yeah.
Hello,
Hi.
nice to meet you.
Yeah.
My name's Miss Smithson. I'm an ENT consultant. I understand you've been waiting for me to come down and see you.
Yeah.
Okay. You've met Steve, our nurse, haven't
Yeah.
you, from A&E? Joe's actually one of my students. Are you all right for her to stay in while I
it's
see
fine.
you? Okay, great, thank you. Joe, if you'd just like to go around, that's lovely. Okay, so I understand you've got quite a... Yeah, that is quite sore. Do you want to tell me what's been happening?
Yeah, about 4 days ago, my mum's dog bit me. Went to another hospital and had the stitches put in.
Yes.
But I've just noticed it doesn't seem to be getting much better and it's a bit sort of tender.
Sure.
So I just wanted to come and check it out, really.
Sure. Any other symptoms at all?
No.
Any pain?
No, not really. It just feels a bit tender, that's all.
And are you feeling well in yourself?
Yeah.
Yeah. And I can see your observations are normal. You've got a normal temperature and things. Yeah. So you're generally well normally?
Yeah, fine, yeah.
Okay. So it was really the redness and that concerned you. You thought better get checked?
Yeah.
Do you know whether they cleaned out the wound when they first, when you first presented?
Yeah, I think so.
I think they did. Okay. All right. I'm going to have a little look at it for you. Okay. And I'll need to put some gloves on for that. So you're comfortable there?
Yeah, fine. Yeah.
It's lovely. So, is it a dog you know? Or?
Yeah.
I'll just come
my
round
mum's
here.
dog. Yeah.
Is it really?
Yeah. We've had him for 8 years.
For 8 years?
Yeah. Since
Goodness me.
Here.
Right.
So, yeah, just quite unusual for him, really.
So it's quite out of character. Yeah. Is he well in himself? Is he?
Yeah, he's
okay?
fine. Yeah.
Have you had him checked out with the vet?
Yeah, we did take him to the vet.
Okay.
They just said that maybe he got a bit sort of startled or something.
Sure. Yeah.
That's why he did it. But yeah, he's fine.
Yeah. All right. So you've got your line of stitches around the back, and then the one at the front.
Yeah.
And then one up on your ear as well. Okay. Does your face feel quite swollen compared to normal?
Yeah, I suppose it feels a bit sort of warm and tender. Yeah.
Are you all right if I have a go at touching this?
Yeah.
So I'm just going to touch. Tell me if it hurts. That's quite sore, isn't it? Okay. And around here?
Yeah.
It is, isn't it? Okay. I don't want to examine that further then until you've had some painkillers to sort out the pain. All right. So, what are your thoughts about what's going on?
I don't know. I guess it just needs sort of restitching and cleaning up a bit, probably.
Yeah. So that's what you're expecting?
Yeah.
Okay. Well, I'm really sorry to have to tell you it's going to involve a bit more treatment than that.
Right, okay.
Yeah, okay. I think you're right. The stitches are infected and you've got some pus under there. But I'd like to take you to theatre to remove the stitches.
Does that mean an operation?
It will. It's a small operation, but it does involve an operation.
Okay.
But I think we need to remove the stitches under anaesthetic and give the wound a good clean for you.
Okay.
I'd like you to have a higher dose of antibiotic, because I understand you have been on some antibiotics, haven't you?
Please, I think it's all
Yeah, that's right. So this is a really good antibiotic, but obviously you've been taking these, and despite these, the wound has become more infected. So I'd actually like to put you on a higher dose, and this time through a drip line.
Okay.
Yeah.
So what does that mean exactly?
Yeah, I can see you're getting a bit anxious.
Yeah.
The idea of having a drip is that the antibiotic's going straight into the veins, so you're getting a higher dose into the wound.
Right.
It does mean you'd need to stay in for a couple of days.
A couple of days?
Yeah, I'm afraid so.
Okay.
Yeah.
I mean, I wasn't really expecting that.
No, I can see you weren't.
But I mean, is it going to be okay, do you think?
I think it will be absolutely fine if we're able to treat it for you and clear up the wound. My worry really is, and I'll explain it to you, it's so red and inflamed, and you're already getting some redness onto your cheek, and I really think we need to treat that before it spreads further. So the likelihood of it healing properly is much higher if we get in there and treat it more aggressively now.
Okay. Yeah. And it has 2 days, you think?
At least 2 days, I'm afraid. Yeah.
She's got so much on at work, that's all.
I know. Is it going to be difficult to take the time off?
Yeah, well, yeah, but I suppose I need to get it sorted out really, don't I? So.
I do think it's important. You've come at a good time. I'm really glad you've presented now, but what I want to do is now optimise your treatment and make sure that we just get rid of all the infection for you.
Okay.
Because you don't want to be left with nasty scarring on your face, do you?
No.
So I think.
That's,
that's
what
can be done? What can be done about work?
I don't know, I'll have to phone them. I'm covering for other people, you see, at the time. So.
Yeah, maybe a few phone calls.
Yeah.
Okay. Are you all right if I show Jo the wound and just sort of explain to her medically what's going on? Okay. So Jo, what can you see? Just describe the wound to me.
Well, first of all, it looks very red and inflamed, and there's quite a lot of pus that looks like it's breaking through the wounds.
Yeah.
And the stitches look very tight as well.
Yeah.
So I'd be a bit concerned about that.
Yeah, definitely. That's one of my main worries, that the stitches look very tight, and I think there's some pus already breaking through, but that's probably evidence of more underneath that's trying to come out. What about the redness around the wound? Yeah, what do you think?
It looks like there could be the beginning of cellulitis, possibly.
I think so. So cellulitis, which is some infection into the soft tissues, I think, absolutely right, which is why I want on some intravenous antibiotics. Yeah, okay. So you'll be with me later in theatre. What other structures will I be looking out for when we open up the wound?
Well, obviously the parotid gland is just under where the wound is.
It's just there, doesn't it? Yeah.
Yeah. And the facial nerve.
That's right. So the facial nerve is very closely associated, isn't it? Well done. Okay.
Yeah.
All right. So that was just a little anatomy lesson there for Jo. Have you had much to eat or drink today?
No, just lunch earlier.
Just lunch, so probably a couple of hours ago. If you could stay not eating and drinking for me, I'll ask the anaesthetist to come down and meet you, and we'll actually probably try and get you up to theatre by late afternoon today.
Oh, okay.
Okay.
Okay, yeah.
So if you've got any people to let know, or
Yeah, I can call them. Yeah.
do you want us to phone anyone for you?
No, it's all right.
No.
I've got my phone.
Okay.
Thanks. Yeah.
Well, Steve, if you could stay with Miss Turlington, Steve will be here with you, and if you've got anything he can sort out for you, then
Okay, thanks.
make him useful. Okay. All right. So I'll be seeing you later.
Okay. Yeah.
Okay.
Thank you.
All right. Jo, should we go back up to
Thank you.
theatres?
Thanks.
Yeah.